The way I look at it, a lot of people ask me, like, aren't you worried about another practice opening up in your market that does the same thing that you do? And I say no, because that's just another voice raising awareness. The more that we educate people on what's out there, the more patients will show up. Because there's a lot of undiagnosed disease that those patients don't know they have the disease unless the awareness is raised.
All right, guys. Hey, I'm here with my good friend, Dr. 𝗀𝗂𝗶𝗹𝗁 from ECCO Medical. I wouldn't probably be here at OEIS today if it wasn't for him. But for the people who are watching,
Full credit.
tell us a little about how you got into the IR space.
So I actually started off initially in ENT in training, and then I went to internal medicine, and then I actually joined a private practice ER group. So I was an emergency medicine physician for 6 years. And then at some point went back into training and was doing my radiology residency while I was in private practice as well. And I went into IR because when I was an ER doc, all the crazy patients that we would see, ruptured spleens, gunshot wounds and everything, they were always going over to IR, and I had no idea what it was that they did. And then after I sent maybe my 30th patient to an IR department via helicopter, I called the IR department that we sent him to and went and observed for a day and knew that that's what I wanted to do for my career.
That's awesome. I feel better now because I just assumed if I went to medical school, I would have known what an IR was. But
they didn't tell us what IR was at all in medical school. It wasn't even like a rotation that was offered. It's nothing.
Well, and I think especially because IR, and we've discussed this, is changing so much that like even what IR is now is different than what IR was 5 years ago, 10 years ago.
Yeah, I mean, I think back when I was in medical school, just based on the timing, I mean, it was more just hospital-based stuff, drains, biopsies, doing traumas. Stroke wasn't, I don't even think, offered in Arkansas at that time. And then as time has moved on, now we're offering, outpatient procedures where the patients aren't critical anymore. You can actually work them up appropriately, things like prostates and knees and things like that. So I think as we progress, we'll become more of that surgical subspecialty where we offer more and more elective procedures.
So now you and I have gotten to work a lot together on the embolizations and you're driving the patients that, what is your favorite embolization to perform? Like, what do you really enjoy doing?
Anything that gets a good result. I think that's, for me, it's that simple. If it's a UFE and the patient's happy, I love it. If it's a GAE and the patient, we had an unbelievable result with the GAE where the guy said he walked on the beach for the first time in 30 years.
Was it one I sent you?
It may have been. I don't know. We're going to say yes for the purposes of this. We're going to say it was. You sent me all of these patients. Yeah. No, we actually just did a PFE patient where, a week later he said that he's had that pain for years. So any embolization where the patient has a good result, that's my favorite procedure.
That's awesome. I have just, we booked you one first PAE the other day, and the guy's goal, don't know why, but he wants to be able to drink Red Bull again. So just know when he comes in, he's got low expectations.
I'm going to be partying.
I just saw that in his why on the chat was he wants to drink Red Bull. So you'll know when you get him. Yeah. So let's talk a little bit about the business. I feel like you've kind of spearheaded this marketing piece at OEIS. What brought that interest and that passion on to bring that here to OEIS?
Personal experience. When I first started the practice in 2020, we were one of those companies that benefited off the pandemic because hospitals didn't just shut down elective procedures; they shut down all outpatient procedures, which included cancer embolizations and PAD cases, which were essential disease states to treat. So we actually ended up getting a lot of those. So early on, we didn't really need the exposure from a marketing. So we didn't have to invest in marketing because we had the exposure. As things started opening back up and volumes went down a little bit, we had to find a way to keep people coming in. And eventually I talked about Lou. He was actually a patient of ours and he got a great result and he was beating down the door for us to help spread the word. And so then seeing the results that we got from it at the time compared to what we do now was a very minimal investment compared to what we do now. It was eye-opening. So from that end, as someone that, is anti-big group, anti-hospital employee, to have an independent practice that can survive just using marketing, kind of became a message that I wanted to get out there to other people who are either of like mind or at least thinking about doing the things that I'm doing now, to really get them to be independent, free thinking and decision making on their own. And marketing seems to be, in my opinion, the best way to get more people to have their own independence.
Do you feel like even just saying marketing just like makes doctors irk sometimes?
I think it does because they don't understand it, and I think the more it's, I guess demystified, I guess the more that the terminology and the concepts behind it are demystified and they understand that it's a tool, but it's your best friend, I think then they won't feel as dirty about it.
You said it earlier, but like in Phoenix, we have this guy, Rafi. Everyone knows Rafi. He's the accident attorney, and he spends millions on billboards.
Right.
But I think every doctor's scared they're going to be Rafi. And they're just going to be the ambulance chaser on the billboard feel.
I think for every Rafi, there's going to be another advertisement that you're going to find that's actually meaningful and worthwhile. I mean, the American Cancer Society has advertisements too. And you can't sit there and say, oh, well, these people are advertising to cure cancer. What jerks.
Jinx.
Yeah. But no, I mean, it's like we'll see a cancer advertisement and we won't assign, that cringy feeling to them. So just be on the side like that. You're there for patient care. It's good to show the world that you're doing it, because the more people know about who you are and what you do, the more patients will show up and get treated.
I think there's a point, and I've always learned this. It's funny, like when someone works at a hospital or where they work for another business, they have no problem asking for money. But I think when they become in ownership, there's this weird, like, I don't want people to think that I'm about this. But
yeah,
what I always taught my clients was, as long as you feel on the transaction that happens, whatever that person's putting in, if you're providing more value than that, you have integrity. And when you're saving someone's limb, when you're giving them mobility again, you don't think that's worth their copay on their insurance? Like,
correct.
But I think that as long as you're there now, if you don't feel genuine about that, then you're probably a con man, and there's probably an issue there.
Correct. I mean, it is, you're right. When you're hospital based, you don't necessarily see the patient go up and pay the copay, but at a hospital, if you don't pay what your insurance plan tells you to pay, that hospital is not going to treat you if you have an insurance plan. So for you to do the exact same thing that you were actually doing earlier in your career, you're not doing anything different than what you've always been doing, but now it just happens to be you and your staff that are demanding the payment. And it's not something that you created. I mean, this system is not in place because of what this one individual doctor did. You're just playing by the rules. You're going by the guidelines. And honestly, you're following the laws, because if you don't do it, technically that's fraud. You're supposed to be asking for that stuff because it's the way the system is.
I think too, and this is for anyone, because I mean, I work with some cash practices as well, but people get really weird about money, billing, all these things, but that reimbursement, whatever it is, that doesn't, I mean, it would be nice if it all went in people's pockets, but that's what pays your front desk. That's what pays for her kids' dance lessons.
Correct.
That's what keeps the doors up. That's what allows you to see the next patient to save their leg or whatever it is. And so I think people need to have a different perception of the business of it as well.
I mean, it doesn't matter what country you're in, okay? You can't treat patients unless you're providing them with medications, procedures, time, and those things cost money. It doesn't matter where you are. You have to have some degree of funding to treat a patient. Additionally, to treat one patient, you probably have to have 5 or 6 staff members, and you have to pay them for their time. And they may have families. They have to provide for their kids. They may be in school. You have to be able to pay them so they can pay for school. I don't know a single doctor in America that volunteers, right? They go and work at a hospital. They're still getting paid even when they're there. Even though they don't have to think about the money there, just because it's not on their mind doesn't mean they aren't taking that check home at the end of the day.
I think, we said it in my talk earlier, but I think to not market is almost a disservice, because I think we live in this little bubble. You guys are here. We're here at OEIS, so everyone knows about PAD. Everyone knows about this. But like the client that we just sent to someone last week, where he was there for plantar fascia pain, he clicked on an ad and he had gangrene on his foot. Like, he didn't go to a primary case. I mean, how long had that been there?
I think it's funny in medicine. Everyone talks about raising awareness for disease states. That is literally marketing, right? Raising awareness is marketing. Marketing is raising awareness. So whatever word you need to apply to elevating your practice or to raise awareness for the disease states that you treat or the procedures that you offer, then you need to do it. Because the way I look at it, a lot of people ask me, like, aren't you worried about another practice opening up in your market that does the same thing that you do? And I say no, because that's just another voice raising awareness. The more that we educate people on what's out there, the more patients will show up. Because there's a lot of undiagnosed disease that those patients don't know they have the disease unless the awareness is raised.
I have a really good friend he runs a mobile IV company. He's one of the largest in the country. And when I asked him, are you concerned about the competition? He goes, I don't need a bigger piece of the pie. I just need the pie to get bigger.
Correct. And the pie only gets bigger with the more people that are doing it and raising awareness or marketing.
Well, and I think the other thing too is just, we said earlier, but just being good at what you do, just patient care, because they might have gone to an IR and the IR was focused just on this, not realizing there was so many things they could have helped them with. So just loving your patients, you always set a difference up.
That's correct. Always look for any way that you can help a patient, because one, you may be able to fix 6 of their problems. And then 2, if you're benefiting the patient, you're going to benefit yourself, because you're going to get paid.
I just want to throw out, you can share some of these, but if you're down to give some tactical nuggets, I've been to your office. It's beautiful. Again, I always talk about the smell because it smells nice in there.
Lovely smell. Yeah, that's just Lisa. That's just how Lisa smells.
But there are so many little things that I think you and your staff have done to really make that experience. I know, to me, like the testimonial cards, you literally give them, say, hey, if you had a good experience, it's like in their aftercare kit. And it just says, ship this out, send it to us. What are some other little touches you think that really make the experience, but also help with marketing?
Yeah, so I think some of the things that we instituted that I think help out with patients and help out with their overall experience is that, we have a couple front office folks. So when a patient calls and they get their referral set up, they're assigned to a front office person. So, Lisa will take the referral and she'll say, and just so you know, I'm your point of contact. When you call up here, if you have any questions, ask for Lisa. So that patient all of a sudden has a name, and it's not an office or a medical practice. It's not a doctor. They have a person that's going to take care of them throughout their entire journey. They're given a second name for if Lisa is on vacation or sick. So they've got it on a card. They say, okay, Lisa's my person, but she's sick today. So, now Kelly's my person. So they have that point of contact. And then when it gets to procedure day, before their procedure, they're assigned to a nurse. So that nurse does the pre-procedure call. Hey, my name's James. I will be your nurse contact here. So they're given names and not a phone number. So they have our phone number, but they're given names. Additionally, we don't have a phone tree. It's just, there's a thing that tells our hours, and then you just press 0 and you get someone on the phone. And everyone in the office is trained to pick up the phone after X amount of rings. If it's on the 3rd ring, that means the front desk can't get to it, so the nurses have to pick it up. So they're always going to get someone on the phone and not have to go through a phone tree. I think the swag bag that you mentioned after procedures, it's a bunch of branded stuff like a coffee cup, some chapstick, some hand sanitizer in that card. That's something that they take home, that they'll have a reminder of their experience from us, in their house. And if, let's hope it was a favorable visit, they'll have a reminder like, oh, that's why my knee doesn't hurt, or that's why that's why my prostate doesn't give me problems anymore, while they drink out of their coffee cup.
That's awesome. I know the question came up earlier in the chat about doing telehealth. One question I get from a lot of providers is bridging that gap from their telehealth consult to a procedure. They're scared to book a procedure spot for someone they've never actually met. How do you guys ensure the person shows up?
So we offer patients both. So every patient gets offered telehealth or in face-to-face visit, and we let them run that part. And I think that gives them a sense of autonomy and a sense of independence. As far as, we have nurse practitioners, one of the things that we do that lets them, get to know me is that I recorded all of my consults for every single disease state and procedure that we do. So every patient, before they show up, they're going to watch a video that could be, 15, 20, 30 minutes long, that goes over the disease state, the treatment options, what we're going to do, and it's me. So even when they haven't met me personally, they've already talked to me for 20, 30 minutes. And then they have a consultation with the nurse practitioner who's going to answer all their additional questions. So from our end, the feedback that we get on those consultation videos, patients love them. Because
we may or may not have used one of those to train our appointment setting staff for PAEs. So they may know who you are.
They may know. Yeah, perfect. Yeah. So it's good though, because they feel like they know me, but also we're not wasting their time either, right? They aren't sitting in a waiting room for 45 minutes waiting for me to become available. They're not getting a rushed version of me that has to come in and come out because I've got 10 other things to do. They're getting a version of me they've got my attention the whole time, and I'm educating them on everything so they can make a good decision. When they see me on procedure day, they feel like they already know me.
Well, and especially doing the marketing you guys do, I think there's something about seeing the ad, going to the website, seeing the guy, and then getting the guy, even if it's in that little piece. I think there's some congruency there that probably helps you guys a lot.
Yeah, I think doctors that move out into the outpatient space, they have to understand that they're the brand. Obviously the brand is my practice, Echo Medical, but I am Echo Medical. And when people see my face, I want them to associate with the practice. And when they hear the practice, I want them to associate it with my face.
What advice, there's so many people here at OAS that are trying to open their OBLs or just start to grow it a little bit. If you could give one piece of advice to that person that's just starting off, what would it be?
Man.
Only one, though.
commit to the bit. I mean, you can't, or I mean, I guess in the words of Ron Swanson, don't half-ass two things, whole-ass one thing. You can't try to work in another practice and do this and make it work. This is your job. This is the only thing you do. This is what you think about when you go to bed, and it's what you think about when you first wake up.
I love it. Well, thanks for being on. Thanks for getting me here.
Appreciate it, man.